Good afternoon. Thank you to our members of the media for being here today. I have a brief statement prior to remarks from the Mayor, and following that we will both be happy to take some questions. Mayor Smook, media, thank you for coming. Earlier this afternoon, Manitoba's Chief Public Health Officer, Dr. Brent Roussin, announced that as a result of rising numbers of COVID-19 cases, areas within the boundaries of the Northern Health Region will move to restricted or condition orange on the provincial pandemic response system. Dr. Roussin outlined the orders that will take effect on Monday, October 26, 2020. Restrictions will include reduced gathering sizes, the closure of casinos, bingo halls, and entertainment facilities with a license under the Liquor, Gaming and Cannabis Control Act that requires the licensee to present live entertainment must close to members of the public, with the exception of providing food for takeout or delivery. Limits to the occupancy of other licensed businesses, retail businesses, and restaurants of 50% of their usual capacity. Limits to the occupancy of personal service businesses of 50% of their usual occupancy, or one person for every 10 square meters of the premises that is open to the public, whichever is less. And requirements for a restaurant or licensed premises, theater, museum, gallery, library, personal service business, concert hall, or fitness facility to keep contact information for members of the public attending their premises and to maintain those records for 21 days to support contact tracing should that be required. I want all Northerners to know that the Health Region has a well-tested pandemic plan that we implemented earlier this year. That plan has contingencies in place for just this situation that we will be implementing. While we clearly need the assistance and cooperation of our partners and all of our citizens, I am confident that our region and the some 2,000 healthcare workers throughout the North are ready, and I am confident we can and will prevail. We ask all Northerners, as we often do, to follow the fundamentals and obey the orders the province outlined earlier today. In fact, I want to urge all of you who can hear my voice not to wait until Monday, the 26th of October, for the orders to take effect and penalties to apply. We can voluntarily comply starting right now and get a head start on the work of beating COVID-19 in our communities and in our North. We can practice physical distancing, 2 meters or 6 feet. Wear a non-medical mask when you are in public places, indoors or outdoors. Practice frequent hand washing or hand sanitizing. And please stay home if you're not feeling well. Let me just add one more thing. If you don't need to be outside your home, then please avoid unnecessary travel and change your plans, even today, if you have any that involve gatherings of more than 5 people. I know our friends in the news media will provide more details of the order and help spread these important messages throughout the community and the North. And now I'd like to call on Mayor Smook, who I am pleased to stand or sit side by side as a true partner this afternoon. Your Worship.
Thank you, Helga. I'm very proud to stand beside Helga, our CEO of the Regional Health Authority. We have worked very hard together over the last couple of weeks to bring this to fruition. Just letting you know, it hasn't been without a lot of thought gone into it, and a lot of people behind the scenes at work that we have worked to bring this to you. Being the largest urban center in the Northern Health region and watching the numbers grow, it is why we are here today together. So, and working together, we want to turn the tide on our region, as we know that we can. And it has gone regional. It is not just Thompson, so it is very important that we remember the fundamentals and take them seriously. As Helga has said, stay home from work if you're sick. Stay home if you can. I've always sort of said shopping is not a family affair, and we've got to go back to that. One person in a family designated to shop. The visiting back and forth has to stop. Even among families, stay to your own pods of home. Our schools, the children are safe. There's in place in that, so just continue to follow the guidelines as Dr. Rusin, and we'll all be fine. The social distancing, the aspect, and follow the health guides. We ourselves follow Dr. Rusin religiously, and it's very important that all of you do that. These precautions are not just about us. They protect the people who are vulnerable and COVID, like our seniors, of which I am one, our parents, our grandparents, and more. We have to encourage them to exercise additional caution, but just as importantly, we need to practice that caution, literally practice what you preach. The City of Thompson has a well-developed pandemic plan and has had in place for a while, and it is ongoing. I urge everyone to cooperate and dedicate themselves to wiping out this COVID in the North. It is definitely something that we have to seriously take, and depends on all of us to work, and all of us to keep our friends updated on how it's going. So thank you very much, and thank you, Helga.
Thank you, Mayor Smook.
Is there any questions?
Natalie Baldwin's EHTM. Some people have been asking this for a while now, like why did it take so long to put these measures in place? Why was there such a delay between when we got the first case to now?
I would depict that as not a delay, but rather designating the North as orange when there was a certain threshold of cases reached. These restrictions on our gathering size, on our movements about our community are not easy for people. So Dr. Brent Rusin really wants to do that when the numbers indicate it should be done, and when we really are at the place of absolutely needing to get people to feel very serious about this. So based on the numbers and based on how the numbers are being transmitted across the region, this is a protective mechanism to seriously attempt to control COVID. COVID is in our control to stop. It doesn't have wings, it doesn't have legs. It moves around on us. So we really can control this, and reducing those gathering sizes, reducing the occupancy in businesses is one of the methods of doing that. But personally, we each need to be responsible for our behaviors. Thanks, Navi.
How good is there, there's still lots of capacity in the North with regard to, any medical issues that may arise from this, and also testing at the testing centers for COVID?
Okay, so I'm going to talk about the testing first, because it sort of follows in logical progression. So we have a capacity at our testing sites to do between 80 and 90 tests a day. On average, we are quite a bit less than that, around 50 to 60, so we watch that on a daily basis. Last weekend, we added a 4-hour clinic on Saturday and a 4-hour clinic testing site on Sunday. We will do that again this weekend here in Thompson. We are also doing that in the PAW. So we can add that surge capacity very quickly and very readily. And we have not had substantial waits. If we look at the lineups getting a little bit longer, we pull in some extra staff to manage that surge. So that's on the testing site capacity. In terms of public health capacity, those really are the people on the front lines doing all the work. They call a case the moment they receive word that it's positive. They call that individual and they do the case investigation and get the list of everybody that they've contacted, and then they in turn contact all the contacts. So they do that very quickly, very diligently, and the goal we've set for ourselves is to do that within 24 hours for each case. So we still have good public health capacity. Public health nurses, Dr. Mike Isaac and Dr. Sarah Lesperance, our MOHs for the North, are working around the clock to manage these cases. And in fact, we are even helping Winnipeg with some of their cases. Some of this can be done by phone. So we are actually even helping Winnipeg because there's just that burgeoning number of cases in Winnipeg right now as well. So we have good public health capacity. In terms of any inpatient care, I just want to firstly remind people that the vast majority of COVID cases recover successfully at home on self-isolation. In the event they need medical care at the hospital, either here, PAW, or Flin Flon, we have our normal processes. We have physicians that will assess, nurses that will assess. If it's deemed that the medical care needs to be better provided in Winnipeg, we have our normal processes with Medivacs, Lifelight, etc. that will transport them. We communicate with Winnipeg. There's that exchange from one physician to another, and that happens if the clinical condition so requires. So all of those normal processes that we would use in normal times still apply and is where we turn for managing patients in the North.
And I think that's where it's important for us as a city to realize we all have our own lane. We all have our own jobs to do. So basically, Anthony and I have been included in the incident command calls. So we are there for support, but we also have our protocol, and we do not do anything without the public health issuance of orders and that. So it's impressive to watch the number of people on those calls and how they have got it so fine-tuned. And when Anthony and I can step in to just help a little bit, that's where we are. But basically, this is the public health, and up here the NRHA's call for anything that moves forward. And I can tell you, just watching them, they're doing a fantastic job in Thompson. And now it's up to us as Thompsonites to do our part, for us to stay home, for us to break the chain and get it. And not just Thompsonites, for the North. Like any unnecessary travel, even if you supposedly can travel north of 53, should not be done. That goes for outlying communities, surrounding communities. I ask you that you please restrict all travel and look after yourselves at home. Thank you, I appreciate that.
And I would just add that we just so appreciate the partnership with the city of Thompson. They joined our command some time ago, and even last weekend, Mayor Smook was making some calls on our behalf to help some of our processes, and those connections are invaluable, Your Worship, and just so appreciate the partnership.
With the new orders in place for schools as well, the high schools will still be from a mix of both in-class and remote. Why was that decision ultimately came to that? Why didn't it just go full on to remote learning? You know,
I think I'm involved with the healthcare system. I'm really not prepared to speak to the educational system. Perhaps we can put you in touch with somebody, Navi, that could answer that question. Or on the next streaming that Dr. Brent Rusin, I'm sure you call into those, Navi, you would have an opportunity to ask him that question.
And I must say, it is nice, Navi, to hear you on the calls to
Yes.
Dr. Rusin and asking the questions. And Ian, I heard you this morning, you were on questions. So that's really important when we see that our North is involved in these discussions, that you're keeping up to date with the public. And Charlene, same from the NRHA, it's just your involvement in keeping us all in line is excellent.
Is there any plans to make sure that you know, businesses and other establishments are abiding by these new restrictions when they come in?
I think, Ian, I would refer you to the website that talks about the enforcement and the process. There are numbers to call. There's a whole list of individuals that can enforce. We heard the Premier earlier this week significantly increasing the amount of the fines. So I would just refer you to the website, Ian, to get that information.
Mayor, so we spoke earlier about I guess, for the traveling up north from south in regards to sort of the restrictions. But what about on the borders, like from Saskatchewan and Northern Ontario? Are those being enforced as well? How is that working?
I believe that is still under, you know, Dr. Roussen's, the travel restrictions, so we would have to refer you to them. Basically, it still goes by the essential travel and what is deemed essential travel. And I think if you ask the individual questions, it's basically almost going to be on a case-by-case basis of, you know, if what you're considered essential up here.
Do the new orders in any way impact on like operations at healthcare facilities? I know you already have masks, you already have visitor limitations. Is there any impact at all as far as your operations go?
No, we will, at this point, visitation will continue as it currently is. I mean, certainly staff will all heighten their behaviors as well. You know, we need to be role models in the community, so I would have an expectation of my staff that they are very well aware of the content of the orders, and that I would challenge all of them that they need to be role models. We need to be setting the example during this time, because the public do watch us as healthcare providers.
And then I guess, Mayor, the same for the city. Is there anything that's going to be changed as a result of this, or?
Can you speak up just a bit? I'm
Is there
sorry.
anything that's going to be changed for the city as a result of this, like
Well,
council meetings, committee meetings, anything like that?
we had a discussion at council Monday, and now we have got the mandated masks in all city buildings that we brought through in following protocol. And now with these new orders, there will be masks through the town, which we have been asked for. And it was better for the province to bring it in than us. But we will definitely be encouraging everybody to wear their mask, everybody to follow the rules. As for, we'll follow the numbers, whatever we're allowed in our public facilities, and that will be going by this new Code Orange rules. And we'd already been, basically right since March, had been taking steps to make sure our staff and the people that are coming, that we service our citizens, have been safe. So it's not like this has surprised us and coming out of the woodwork. We just had a very lucky spring and summer. Mm-hmm. And now, you know, it's up to us. We may have got a little bit lax just in general. It's time for us to tighten up again and realize that reality is here.
With the mandatory masks in place, it's one thing to ask people to wear masks, but asking them to wear it properly is another story. So how will that be enforced? Will it be up to employees or business owners to do that? And could you go into that a bit more?
You know, Navi, that's a really interesting question, because even when I go into Safeway, or, you know, when I see people with the mask down under their nose, and I mean, I have stopped people and say, you know, the proper way to wear that is, you know, the way we have them on. So I think it's up to each one of us to sort of, in a gentle, kind way, to correct people.
Okay, thank you.
I actually went to a hair salon today and got my hair cut, and just before me she had actually had somebody that was refusing to wear a mask, had an appointment, and she had actually said, please come back when the pandemic's over and I'll be pleased to serve you. So it's up to each and every one, but yeah, so that's, you know, it's up to us to set examples. It's up to us, if people aren't following rules, be brave enough to say, sorry, I can't help you if you haven't got your mask or following the rules.
And we really need to, this whole, Dr. Rusin speaks about this, we need to be kind to each other. During this pandemic, we need to care about each other. Now is not the time to chastise somebody, to embarrass anyone. That the stigma, we see examples even here in the north of really pretty dramatic stigmatism, and that is just so disheartening, because if ever we needed people to be honest about where they've been, honest about who they've been in contact with, we have to create that safe environment where they will feel comfortable telling the public health nurse or the medical officer of health about that. And if they fear retribution or stigma or blame or embarrassment, they're not going to tend to be honest. So we absolutely need to be so careful in our approach with people, and always just be supportive and kind. I just can't think of a better word than just let's be kind to each other.
And Colin, what was your reaction when you found out that this was going to be brought in, further restrictions?
I guess it wasn't an unexpected reaction. We actually called the northern mayors and community leaders together yesterday for a conference call, just to talk about the north and how this COVID was affecting the north. And we did have some leaders from public health on and just explained it. And we just made everybody understand. If any of the other mayors, MKO, KTC had any questions, that was the place to ask them. We basically come away with a unanimous, whatever Dr. Rusin was about to roll out, that we were willing to be part of it as a combined north. I think, and the fact everybody keeps saying, why did we wait so long? You realize it's less than 2 weeks that this breakout all started. So I think in that 10 days or so, I think we've done a pretty good job of rolling it out. Yes, it has been spreading, but now is the time that we can start having the numbers plateau and go the other way. So that's why it's just very important that when we are a full 2 weeks in, if we can already say that, within a couple days the numbers are plateauing, we would like nothing better.
I just wanted to ask about the capacity of the isolation units in Thompson. How many units are there for self-isolation for individuals who aren't able to isolate at home?
Okay, so you're talking about alternate isolation, and I think, Navi, so we have a number of places where we can alternately isolate if they don't need medical care. Again, most of the clients experiencing COVID can recover successfully at home. So we do have a number of alternate isolation spaces, and we are working to get more. Again, in that spirit of being concerned about stigma, and we don't talk about where those places are, but we provide them, and we find more as we need more and make the arrangements with those businesses. And at this point, we have adequate, with more coming on side.
And with the patients who may have more serious illness from the virus, how many beds are available to them in ventilators?
Well, if a client needs a ventilator, that would be a transfer to Winnipeg, Navi. We don't have 24/7 respiratory therapy, and as in any time, COVID or non-COVID, a person who requires ventilation would be transferred to Winnipeg. They are poised to accept the patients. That is their role. Health Sciences Centre in St. Boniface, that is their role, providing that additional level of care. So that would be our process there.
And they would have the capacity to serve the northern region?
Yes,
in addition to
yes.
Okay.
We're good.
Thank you very much.
Thank you very much.
We appreciate it. Remember, wash your hands. Stay safe.